I am going to have to go back real quick with slide one. I'm sorry about that. I won't take long. It'll be quick. All right, guys. So basically here, the ANCC will be 3.5 hours with 150 questions, of which 25 are dummy questions. They are not valid. Please focus on every single question. Let's keep into point number 11. ANCC usually does not list normal levels. This again, your initial default is your knowledge. Your second default is the strategy. Let's say you get a lab of a hemocrit that you never heard of, or you don't know the right answer, then you could possibly assume that's incorrect values, okay? Down below, you have the breakdown of the most important sessions. The most important session is the advanced practice skills, contains 41 questions, followed by scientific foundation, diagnostic treatment, which are 33 questions each. The least amount of questions come from psychotherapy and related theories, and followed by the ethical and legal principles. Okay, we mentioned about evidence-based. Please make sure you know what are the evidence-based or belonging to. Systematic review and meta-analysis are the strongest, followed by all the other, the RTCs, and the least amount is the expert opinion. Expert opinion does not yield very much. However, if it's something regarding to COVID, where we had no meta-analysis, where we had no systematic review, that's the only thing that we have, then that would possibly be the choice. But I would highly, highly doubt they would ever ask a question like that. Anyways, culture. When you see a culture question, look for culture-sensitive answer, right? Culture, races, ethnicities, all that. You should look for something that's sensitive. For example, someone's scrub leaves on their skin and becomes irritated. Your job is not to say, oh my, you need to go to the hospital, but your job is to look for something along, tell me how you feel, or tell me what does it mean in your culture. Help me understand, okay? And that also goes for religious practice as well. Regarding socioeconomic status, please understand that that is anything that can stop the patient from getting care. Money, location, access to transport, and so on. Okay. So I mentioned here, just because it has a culture or country, it doesn't mean necessarily will be a ethnical question or ethnicity question. For example, here's carbamazepine, which can predispose those of Asians, descent, possibly Steven Johnson syndrome, right? Just because it had Asian in the question doesn't mean it is what you're looking for. So don't get that confused. Now back to number 15, and I will slow down here a little bit. So basically here I'm saying that anything that is culture, respect, and abuse, understand we have to respect all cultures. Do not reassure, but support. For example, don't promise something that you cannot do. Offer something that's reliable, perhaps information. Example, someone's house got on fire. You cannot tell the person everything is going to be okay, but you can say, here is some support to FEMA. Here is some local support to this place where you can stay overnight. Okay. So anatomical parts, understand the anatomical parts of the brain. You will likely get a question about the lobe. Understand all what we've been going through in details on each of the videos. In the videos, if they are highlighted, that's high yield questions that most likely be on a test in some way, shape, or form. I don't know how they'll come, but it's known to get a lot of students. So in order to score well, it's good to think like the test makers, right? If you are confused about something, it's likely that other people would also be confused about. So these are the things you need to focus on. Okay? So you need to understand some, but not all, primary care medications interactions. Why? Well, it's simple because some of them interact with what we do. Here, example, clonidine, right? We can use that for ADHD and Tourette's. or opioid withdrawals, right? So that's not a psychiatric medication, but is well used in those realms. Understand that if someone has Tourette and they are on stimulants, they need to stop the stimulants and prescribe clonidine or guanfacine, for example. Okay, but also know that the clonidine is contraindicated in patients with heart condition because of its alpha 2 androgenic properties. Another example here is propranolol. It's not a psychiatric medication per se, but it's used for anxiety and panic disorders and akathisia, okay, caused by antipsychotics use. However, it's contraindicated. Highlight this. This is contraindicated for patients with heart failure, so you have to be mindful of that. Okay, now when it comes to psychotropic medications, you don't have to take the whole psychopharm class again. And that's why in our course, I always tell people, if your goal is to pass the board right now, the 30 days PMHNP Walk to Success is the best choice. If you are a year away from passing the board, or if you already passed the board and you want to really get in depth in the psychopharmacology drugs, every single one of them will pretty much cover in this course, then you can take that. But you don't have to take the PMHNP psychopharmacology course just for the board. You should not, because we're going too much detail that's not relevant to the board, okay? So, however, you need to know all medications that have a black box warning, or any medication that's specific has a contraindication, or does something to a specific class of patient. We mentioned carbamazepine earlier. For example, here, lithium and clozapine. Lithium and clozapine are the only two drugs associated with decreased suicidality, right? So there are no antidepressants that have been shown to decrease suicidalities in patients. As far as decreased suicidality alone, obviously, if you decrease the mood, if you increase their feeling better about themselves, that likely extends to suicidality, decreasing suicidality. Okay, genetic names and brand names, they usually come together in the questions. They will almost never give you just a name. So what does it mean to you? You don't have to be concerned. Do I need to know both names? Whatever name of the medication you know, that's fine. That would work just as well. Okay. Different disorders are tested on the first treatment line by NCC. For example, major depressive disorder would be SSRIs. There would not be transcranial, let's say, vagus nerve implants for betterment of the mood, right? Which we use in practice at some places, but would not be one of your choices because they want to know what is the gold standard. So that being said, if you find yourself between a exotic answer and something that you're not too sure, you better go with something that you're not too sure, because they almost never put exotic answers, only as a distraction, because we know if I don't know the answer and I see this term that I never seen before, I am more inclined to press on it because it looks different, right? So that's a distraction. So if you don't know the answer and you see terminology that you never heard of ever, most likely it is a distraction, okay? So when you're testing for the board, review the notes, videos that we have provided. Make sure you know everything that's in the PDF, okay? Everything. You can do this easily if you have access to the Brainscape app. They basically are broken down by session, by each of those modules. You can quickly, I know this, I don't know this, and you mark it down the ones that you don't know. And eventually that app, what it does is take away the things that you don't know and separate them from the things that you know so you can focus study. Focus study is not studying a whole lot, but study efficiently. A lot of us, especially those that don't do well, we study a lot, but they study the same thing over and over and over to soothe the ego of saying, I'm doing my best, when in reality, they should only be focused on things that they don't know. If you know that carbamazepine has a propensity to cause Stevens-Jones syndrome in the Asian population, why are you going over the same thing over and over again if you already know? Therefore, you should focus on the things that you don't know, okay? And that way the content starts very, very large, and then it comes down to very, very little at the end. And the end are the things that you don't know. I know it's a shift in mindset, okay? But if you do this, be confident on things that you don't know, and be confident in the things that you do know, and separate them and focus only on things that you don't know. Okay? Again, I cannot see the check box or see anyone. So if you have a question, please stop me, okay? So some psychotropic medications makes patients more prone to secondary conditions, such as endocrine conditions, such as metabolic syndromes, right? So we really need to be vigilant to that, because you have to think ANCC does not want you to be expert. They want you to be safe in prescribing. Only safe in prescribing, only safe in providing good advice, only safe in therapy, only making sure that you know the warning signs for the patients, okay? So common side effects associated with some medications, you don't have to know all of them. We need to know what are the keys, the most important. And this will bother a lot of people, because we are not studying for a test that's specific in anxiety, that we need to know all the medications, the alpha 2, deltas, like gabapentin or pregabalin, SSRIs, all the antidepressants. So we don't need to know all of them in detail. All we need to know is the class, the name, the usual dose, and something that's specific about it, okay? Because we are not testing in school where they might pick very small things. The ANCC is looking for the bigger picture, okay? So there are signs and symptoms of hypo and hyperthyroidism, right? And that's important because although hyper and hypothyroidism is not a psychiatric condition, but they mimic a psychiatric condition, we must be sure to separate them, and we do so by requesting the labs, thyroid labs, okay? So another example of that is that lithium, patients' thyroid level for lithium and the risks for developing not hyper, hypothyroidism with lithium, right? So if we cause, I know this is going to throw off a lot of people, but if we cause a symptom, for example, of hypothyroidism, then in real practice, you treat that with the appropriate medication, okay? Because it's your cause. You could to refer, but refer is almost never the right answer, unless it's pediatrics, OB, or in case of substance use, specific cases where they need inpatient treatment or rehabilitation, okay? These are the very rare occasions where referring could be the right answer. Now, we need to know about psychotropic meds, especially antipsychotics, and the BMI and monitor for metabolic syndrome. The first sign of that would be your hip to waist ratio or your abdominal circumference. Okay, things along those lines that we cover in detail in the course. Now, if a patient is stable on their medication and doesn't want to change, then your first action is to encourage lifestyle modification. So always be on the lookout for when the patient is stable and when they don't necessarily want to change, what are the things that you can do? Lifestyle, uh, changes like exercising and so forth. Okay.
Can I ask a question about what you
Yes,
just
please.
said? So like
Yes.
if on the test, if it says, which of the following is the most important to monitor when on medications that can um, where there's a higher risk for metabolic disorders. And if they have the answers as BMI or waist to hip ratio, which one of those is more correct?
The first one, right?
BMI?
The first one. No, I'm sorry. No, the hip to weight to ratio issue. Because the BMI, it can be very faulty. I can get a 250 pounds guy and he doesn't pass his BMI because he's very muscular. So you often they will ask, what's the first symptom that you see or the first sign of metabolic syndrome? I guarantee you that you get a question or either about hip to ratio or abdominal circumference. They may change the terminology, but this is a well-known question because we know this in books again over and over again. That's highlighted is the first thing that you see as an increase. And the thought behind that is they want to know that before you prescribed, you took measurements of that. Okay. So thank you for the question, and please ask questions because I cannot see you, I cannot see the chat, I cannot see anyone. So I'm only seeing my presentation. If you need to ask a question, stop me, or you don't understand, ask question. Okay.
Dr. Charles, I have
Yes,
a question.
please.
Yeah. These slides you are using, are we supposed to have it?
Yes, I'm making again. I'm gonna record this one. I can give you this, but this was a very short introduction. Very short. I am going details again for the course, folks, and they'll be posted on the course. But the reason for today's event initially was to support module 2 and 3 of our PMHNP course. However, there are a few people that are testing within 10 days. I just want to make sure that they got a hold of this content. I want to make sure that we can go over through practice questions so they can be ready for the test, so most ready for the test. So I had to skip a little bit of our schedule. But once this is recorded and made in a better tone of voice, in a better audio, I will post it into the modules there for our website. However, this will be recorded too and will be posted immediately within 24 hours after I receive it back from Google. So
Sure. Thank you.
absolutely. Any other question, guys, so far? Okay. So in regards to therapies, especially family therapy, that will confuse a lot of people. Okay. So we have a module specifically on family therapy as well, where we break down at least 3 of the most important components of each of the family therapies. So if you memorize those 3 out of all those family therapies, there are a lot, they confuse a lot of people, you should be good to go. Okay. So therapies is important, especially you need to know names of the most important ones like DBT, Marshall Lineham, like CBT, and so forth. Like, you know, things like Referral or Erickson stage, you will get a question, something along those lines, because they're a classic. They've been in the literature for years and years and years. Most likely you'll get a question on that. Okay. So when it comes to our course, we cannot and should not go over everything, right? We should only go over the very, very high yield, because that should give you 70, 80% of the test content. You will get questions about herbs, let's say, but there are 30 different herbs. So it's not high yield to cover 30 different herbs for you when you might get one question, right? So it's high yield to cover things that you might get 3, 4, 5 questions. And this is why we cover only the high yield, most important part of the exams. Now, a lot of people have mentioned, a lot of people that are practice test 1 which is the one that we are going to go over today, is a very good measurement of success. So to pair this up, I think only one person so far achieved the 85%. So by the time you take your test, ideally you should be above 85, which means you retake it, stop, collect the answers, and look of the reasoning why. We'll be going over some of the reasons today, but it's not the same thing as you going after and you looking at it and you researching. That's always more powerful than just giving, okay? And then we can always go back to the questions and answer them in different ways or have different rationales for it. Okay, so when doing assessment in children, most of the children have gained some competency in abstract thinking or concrete thinking by the age of 10, 11. So it can be asked questions to assess the logical thinking, you know. So here I am referring to Piaget stages or Erickson stages at some point, right? But be mindful of well, we'll go over this in class because some of let's say Erickson stages, okay, age is important. So if I say that someone is on whatever one of the stages and they give you an age, like this theme of the question give you an age, and they ask you about Erickson, a test-taking strategy is if you know the age, the answer, the right answer will be the right age. Now, if we're looking at Piaget, the answer cannot or sometimes will not be related to the right age. So that's important for you to know because that becomes a test-taking strategy. If you don't know the answer, but it's Erickson stages, look at the age of the patient because they'll say a school age, or they may say 14 years old, and all you got to do is match the age to the answer. Make it simple, okay? Now, since you are expected to test as a new grad, again, this is the diagnosis usually presented as in a classic textbooks symptoms and format, meaning that they will not send something that's exotic. If you find something that's exotic, be at least aware of that fact that they're looking for something that it's exotic. Now, that they're not looking for something that's exotic. Now, if you get questions about schizophrenia, you may know that ETC is good for the treatment of a major depressive disorder resistant and schizophrenia or any psychosis like with major depressive disorder, right? So that wouldn't be, that's not to say that we are going to use SSRIs because they are major depressive disorder with psychosis and resistance. Then therefore the main treatment would be anti-convulsive the therapy, the shock therapy, some may say it, okay? So when to refer to others, we mentioned then, again, when you see pregnancy, most of the time can be a referral or collaboration. What I mean by this is mothers are in the OB department and they're leaving the department without having a major depressive disorder check, right? What should you do? Well, collaborate with the OB department, make sure they have at least a screening and the follow-up appointment in case if they screen positive. That's the referring part. Substance abuse. Can you treat a substance abuse patient with COWS score of 18, 19 on your office? No, you can't. And that's the reason why we're referring. Can you treat someone or a teenage, no, not teenager, a 5 years old girl with Rett syndrome? No, you cannot. So that's referral, okay? However, if there are two referral questions and one of them may say, look for something that you can do. Let's say go back to the Reddit case here, Reddit syndrome. If this the question is says refer to the appropriate neurological treatment or appropriate provider, and the other one might say, I'm just making this up. This is not real test. The other one say collect the labs and then send it to the appropriate provider. You'd pick that one because there is something that you can do about collect the lab, followed by the most important part, which is the referring. Okay. We mentioned about exotic answers. You usually do not pick the answer. Now, let's go over how to really amplify your score. I just give you a little synapse. Now, these are really believe, okay? If you started hard before your test, the test day is easy. It will be an easy day. It only becomes hard when you think it's hard, okay? Let me give you an example. The day before my test, I went out, I had a good steak, I had good wine. I was already celebrating with no fear whatsoever. Just like a regular day, but a happy day. Because the day has come that you will get certified. So you get in with the mindset that you know everything, that the test makers cannot trick you. So you believe in that, and you visualize in that, and obviously you study for that. Okay, so as you walk in that, you are relaxed. It should not be something that's going to take your breath away. You have done the hard work before. Now it's the easy part. It's just the click of the button and picking the right answer that you know the answers already. What I mean by knowing the answer is as you have studied, it will be an easy day. But if you amp yourself up, oh my God, there's no test. Oh my God, they might know everything. Oh my God, what's going on? Then you're likely not to do well because you're anxious. And I've seen this at least a few times where somebody does really well on the diagnostic test and don't pass. And I go, what happened? And the person goes, I was too nervous. I was shaking. So if that's you, try to incorporate some measurements or some ways to decrease your anxiety, whether it is by doing lots of practice tests, whether it is by taking a medication if it's appropriate to you. But know that when you are anxious, your anxiety will take over everything and will focus only on one thing. It will be, instead of being widely focused, which the questions are widely focused, it will be very narrow focus, and you're likely to miss your answers. Okay, so please,
slow breathing and grounding techniques if it's during
absolutely,
the test.
Absolutely. So that being, thank you for that. So that being said, for example, I am a religious, and everybody kind of knows this in a sense because I post a lot of things about religions, and I do apologize if I offends anyone, but that's who I am. You know, before I do a hard test or when I worked in ICU, right, I had the very sick patients. And, you know, in my job, in my line of work, in the ICU, you are more so the doctor than the doctors themselves because you do a whole lot without them, specifically where I work. So basically, every day was a battle, right? So before I start my day, I start with a prayer. Start with a prayer. For my test score, once I review some techniques that I will go over with you, ground yourself. You know, thank God for every single question. Thank God for being alive or whatever you believe. I don't mean God, my God. Whatever you believe, whatever grounds you, whatever makes you happy. If your children make you happy, you know, that's what I visualize, you know, when I'm going through a hard time, whether it's physical exercise that I have to do or whatever have you, I always put my children at the end of the line waiting for me, right? So that motivates me. Whatever motivates you and calms you down, use that. And this is very individualized to each one of you, what's important to you. Okay. So deep breathing, as mentioned, is so very important. Oftentimes, if you don't know the answer for a question, close your eyes and take 10 deep breaths. Just think about nothing. Go back to the question. Eliminate 2 of them. You'll have a strike through options. You eliminate 2 of them, and the right side of the screen may be a review, maybe left side of the screen. You can press a review. That means you can go back to this question later. When it comes to the end of the test, last 10 minutes, go back to those review questions. You already eliminated 2 right away. Just focus on the 2 options that is left. So you don't have to read the question again. All the, you gotta eliminate every time you go through a questions, even if you don't know the right answer, you are going to eliminate one or two of the answer choices. And then if you really don't know, mark it for review later. This will help you. They have strike through, which will be the incorrect, and they have highlight portions. So as you read in the question, highlight the important things about the question. Yellow, highlight it. Look at your answers. Is not, cross it. Is not, cross it. Do not pick the first feel-good answer because it suits you without reading the other answers, right? Because that it is, again, something that we know will get a lot of people. Oftentimes, I put a distraction as the first answer because I know a lot of people will pick that answer because it seems reasonable and they're in a hurry. So, for example, the difference between recall and, I don't know, let's say recall and
Registration.
First thing I'll do, I'll put a recall as the first A if I want to be mean, because a lot of people, 90% will pick recall when this registration is the right answer, right? Because recall is when you do a MMSE and you say something to someone and they are able to remember after 5 minutes. Registration is, do you understand, did you register that this is a cell phone, right? But recall, it sounds really good, doesn't it? So for that reason, it's a distraction. So if I just read recall, oh, that's the right answer, and I move on, I lost the easy, well, maybe not so easy point because that one will get a lot of people, but some easy questions, I'll miss it. And a lot of this, believe it or not, is not about knowledge, like concrete knowledge, pure knowledge. It's about how you see the world. It's about how you interact with others. It's about how you feel on the test day. Okay, so making sure that you're calm and easy and collected. Walking the test day like you're the champion. Take nothing less than that. Nothing. Like this is already a won battle. Okay, but if you believe it is, then it will be. If you believe that's not, there won't be. Okay, so walking high, chest up, feeling good. Okay, because you got this. So you do the hard work now, and the test day will be an easy day. Now let me go back here to this point number 3. There will be a 50 minutes tutorial. I did not care about the tutorial. The tutorial you can find it online. You can read it now. So what does it mean? It means you have 50 minutes to do your dumping sheet. What is your dumping sheet? Dumping sheets are the things that usually you get confused. It's specific to you only. Let me give you an example. Erickson stages. Oh, I don't know what age is this or what age is that. So you go ahead and write the mnemonics right now. As soon as you set in, you do your prayer, you do your deep breathing, you do your grounding. Your next step is do a dumping sheet. So you put the Erickson stage. You put the mnemonics for inhibitors, medications. You put the mnemonics for medication that could cause major depressive disorder or manic stage. You put that, whatever you think you have trouble with, but you don't put there like a journal just because you know a journal. Again, you're going to the things that you don't know. Don't be filling the paper up just for your own ego. Do this for the things that you don't know of, that you have problems with, that you often get confused about. Okay? And use the mnemonics, not so much the whole thing, because easily, when you're question number 115, by this time you're tired and you're getting more nervous because you're coming to an end, you can easily go back and look, oh, this is the Erickson stage. Right here, my answer, I wrote down on my dumping sheet, right? So you don't have to be confused about it anymore because you wrote down your dumping sheet. You just look at it like, oh, got it, too easy, and you move on. Okay, it's very important to do a dumping sheet. Later, I can show you an example of my own dumping sheet. I can make one, but ideally, it's you. It's individualized. It's your own thought process, how you're thinking, how you're seeing things, and what are the things specific to you that gets you. Okay, and you can do this by going through the PDFs that I give you, and each one of those topics, ask yourself, can I teach this topic? Can I say this topic? If I say, for example, lithium, okay, let's go over lithium. Okay, lithium 0.6 to 1.2. If it's more than 1.5, it is toxicity. What are the signs of toxicities? And you go over to everything that you can remember about the topic, you need to tell yourself, right? And things that you don't remember are most likely the things that you can put in your dumping sheet. So a good exercise is to look at each one of those topics and talk to yourself. Talk to every one of them, okay? Talk to yourself what you know about it. And be like, gee, I forgot this is a therapy that we use for this kind of disorder. I forgot who made it. So these are the things that I need to be aware of. Putting in the self-awareness, okay? All right, so you'll be giving 2 scratcher papers. Not really, it's laminated paper. Make sure when you get those 2 papers, you ask for a new pen. You pay a lot of money for this test. You want a new pen because the least thing you want is you have a crappy pen that doesn't work in the middle of your test. It's dry erasers, okay? You get 2 of them, 2 pieces of plastic, so laminated papers. Make sure you get a new pen, okay? I mentioned about the dumping sheet. Okay, so you jot down all the important things. If you feel that going through the tutorial would be helpful to you, then take about a minute or 2 to do so. And then utilize your dumping sheet a lot throughout your test. Okay, as the exam starts, flag questions if you want to go back to the questions. We mentioned that for review. You can use highlights and focus on the question that are, what's important about the question, the stem of the question. You may be able to strike through, right? So that means when you strike through, you're no longer interested in the answer. Carefully and slowly read the question and separate out the jargon and distraction. Every question will be a distraction. I guarantee you that. Every question will be a distraction. And maybe the best answer, where 2 answers are correct, but one is the best answer. For example, which of the following medications do you use for someone initial major depressive disorder? And then you have TCA, SSRIs. Then you'd pick the SSRIs. Why? Because it's less lithium in case of an overdose, right? Well, but TCA is the right answer too. It is. Just not the best answer. Okay, so read the question carefully and slowly. Another reason why you do a practice test is to time you for the real exam. I've seen people here finish the practice test in like 1 hour and 20 minutes. So they had more than 1 hour and a half left to digest the test, right? So it's for you to find yourself comfortable with that 4 hours test, 3.5 hours, right? So you do that by taking the practice test. So, and they'll post it up a second practice test and possibly a third in the upcoming days. So if only part of the answer is correct, do not pick it the answer, because in order for answer to be correct, it needs to be the entire thing correct. Example, let's say that in the mesolimbic pathway, dopamine is responsible for the psychotic features, and in the mesolimbic pathway, prolactin is responsible for the negative symptoms. So the second part is incorrect, so the answer is not that. Okay, so if there is an and or things along those lines, you make sure the whole answer is correct. And questions will always have distractions. Okay, so no partial points, no partial correct answer, always the whole entire answer question. Not a good distraction. Something that's related to the question but is not answering the question. So let's say psychosis. The question is asking about the pathway, and one of the answer choice may be second generation antipsychotic has been proven to be excellent choice for psychotic features. Well, it wasn't asking about medication. It's a fair statement, it's a right statement, yes, but it's not for the question. So be aware of that. This is very blunt and separated here, but it can get very close and narrow of what the question's asking. But ask yourself, is this what the question's asking? Right? If it's not what the question is asking, then it's not the right choice. Even though the statement is correct, it's not the right choice. Another thing is that assume that you have all the information in the question. You don't need to overread or think in my hospital, in my practice. Again, this is a national test. What you do in Arizona, it may not be what you do in Florida. Think about the broad standards. Okay. Avoid exotic answers. Choose the first answer that comes to mind. I am kind of biased against that, but it has been shown to help a lot of people. Usually when they change my answers because something clicked, and then I go back for sure and change my answer. But for most people, is whatever answer comes first. A good practice is you read the question, don't look at the answer. Answer the question. What would you be looking for in the answers? You know, for example, let's say that the signs and symptoms of metabolic syndrome, and you'll be like, okay, increased blood sugar, hip to weight to ratio, circumference, BMI, blah blah blah, and then you look at your answer, like, yeah, here you go, hip circumference. You know, so kind of tell yourself what the answer is before you even see the answer. That usually helps a lot. Okay. So look for patterns of the answers. If you have something that says hypo and one that says hyper, I can almost guarantee that the other two answer choices are incorrect, and it will be either the hypo or the hyper, because that shows a pattern that our test makers use to do tests, right? If you see something that's symptoms of mania and the other one is symptom of depression, you kind of like they go in different directions. So most likely, one of the two may be the right answers. Now, always, this is test-taking strategy. Knowledge is the fundamental, but test-taking strategy will help you a lot. Okay, will easily can increase your your points by 20%, 15%, and that means a very, very, very high percentage of y'all will pass undoubtedly on the first try. If you use this, think yourself, you can take the practical exam slowly. Think yourself, what are the test taking strategies? What am I reading? And then you apply the test taking strategy, and then you look at the answers and see if they match. Okay. No penalty for guessing, right? So I heard some people leaving 10 questions out without answering, without guessing, because they were too nervous, taking too long. I mean, pick something, even if you don't know what it is, strike through, click review, come back to 2 answer choices. Don't leave blank. That's a death sentence right there. Using guided imagery or deep breathing or relaxations as you need, whatever comes you down. For me,
What?
it's prayers. Go ahead.
On the whenever you're taking the test, does it tell you before you submit all of your answers? Does it say like you've got 5 unanswered, or does it show the numbers that are unanswered? Does it give you some kind of indication in case you missed one?
I want to say, I'm going back in time, okay? I want to say yes. Those might say questions 1 or 2 answers hasn't been answered.
Hey,
Uh,
Marie, I'm sorry, Dr. Lopez. It does.
it does, right? Yep.
It
Thank
won't
you.
even let you submit. It'll say you have
Thank
so
you.
many still to submit.
Okay, so thank you for that. I'm pretty sure it did. And I think it also may say, it will say for sure the ones that you have highlighted for review. Not just highlight, but click the review. Okay. I'm talking a lot here, guys, but I hope this is helpful to you. And if you have a question, please stop me. I cannot see you. Okay. If you're getting computer or question fatigue, which will most likely get, right? Consider taking a small break. As I mentioned, some people finish the practice test in an hour and a half, right? Now, know that the clock will not stop, but just closing your eyes, taking a deep breath, relax, think of something happy, whatever makes you happy, your kids, your house, your car, or your makeup, whatever makes you happy. Think about it, and then go back to it. One of the reasons I broke down the course in small content, because research has really enforced of the breaks in between content. The same thing is with those questions. If you've gone through 30 different questions and you're doing a good time, understand that it's about a minute and 10 seconds, give or take, for each question, a minute and 20 seconds maybe for each question. So if you're doing them in 35 minutes, 35 seconds, you got a good time. So you can take a break and relax a little and go right back to it. More focus every time, right? Because every time we take a break, we come back and we are more focused on it. Okay. So understand that the clock doesn't stop. Hopefully you have taken the full length practice exam by now, right? Answers in absolute words usually are not correct. Anything that says all, none, or never, always, be aware of those answers as possibly incorrect. Okay. Always be aware of the answers that mostly, sometimes, and often as well. Okay. Watch the test taking strategy videos, and then I'll have it posted in our website. Now, I am going to go over, let me stop this for a second. All right, so what are your questions about what we went over? Any specific thing comes to mind? Okay, so it's been an hour. So let's take about 5 minutes break. I'll see you guys at 7:10. Okay, Eastern time. I don't know what time zone you in. So about 6 minutes break, and I'll see you guys in a few minutes. Is that good?
Yes.
Okay.
Yes.
You guys, and then we'll go over another test taking strategy. It will take only 10 minutes, and then we'll hop on into the quizzes. We'll cover about 50 to 100 questions fast. Okay. See you guys in 5 minutes. Bye-bye. Okay, guys, we're back. Can you hear me? Can somebody say if you hear me,
Yes.
please?
Yes.
Okay, great. So I want to go over it again. Test taking strategy really quick. This will be five minutes, very fast. I just want to summarize. So read the entire question. Pay attention on keywords. Do not read the question. Do not read into the question. Do not read into the question. Only use the information that's provided. Read all the answer questions, all of them. Narrow down to 2 options. Partially correct answers are not the correct answers. Some same keywords and sentiments. If you're stuck in a question and you don't know the answer, that's the only strategy. Doesn't substitute knowledge. Look for keywords that's in the name of the question and look for the keyword in the answer question. And see if they are similar or kind of relates to it. And most likely this might be the right question, answer. Okay? Always choose client focus question. For example, let's say I'm taking care of an Alzheimer's patient. I'm the father, the son of an Alzheimer's patient. Well, my father has Alzheimer and I am obviously his son. And I'm taking care of him. And I come back to the office and I say that he's been gone and has been a burden on the family and blah, 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 blah. That's not client focus. The focus is the father with schizophrenia. So that would be the answer. Not the task makers who know this is a burden. They will know this is a problem for the family, but that's not what it's best for the patient in question. Okay? So be mindful of that. Choose the client focus. When answer choices are marked similarly, like I mentioned, hypo or hyper, they most likely, well, when the answer choices are marked similarly, let's say if you have 2 questions about ADHD and then you have methylphenidate or another stimulants, let's say this way, then most likely they're both wrong because they both are used for ADHD condition, infinidate and methylphenidate. So most likely that's the wrong. You can mark those as wrong. Look for something that's different, maybe a non-stimulant option. Okay, we mentioned about all, only, always. Stay away from that. Now, question number 4 here. It's so very important. I want to stop for this. When this says priority or initial action, it's asking your ability to prioritize. So what's the priorities? It breaks down into 3 sessions here. Your priority is airway, breathing, circulation. I don't care if the client is suicidal or it's actively going to harm someone. It doesn't matter what it is. If they can breathe, they can move. If there is no circulation, they can't move. So your priority is always ABC. There'll be very few questions on that, but make sure you understand your priorities. Then your second priority is Maslow hierarchies of needs. Okay, so if you look at the course, there is a pyramid where it says in the bottom is the most essential. Safety, is housing, is food, is water. On the top of the pyramid is self-actualization. Basically, you're going through school, you got married, you got kids, or what have you. You have a place to stay, you are safe. Now, how can I better myself? How can I be at the top of the pyramid with my education and job and accomplishment? That's important, but it's not as important as safety or in being a neighborhood that's safe. See what I'm saying? So, and then the third option is your nursing process. Now you are at the nursing process. If you had no option A, airway, breathing, circulation, option B, Maslow's is out, then you go through the nursing process. So in the nursing process, you look for assessment as your first likely option, right? And assessment here will get a lot of people. Why? Because assessment here is not the same assessment as a nurse, you know? For example, vital signs, that's assessment. You'd be like, no, that's an intervention. No, it's not. because assessment, you collect information. Anytime you collect information, research is assessment, vital signs is an assessment, surveys and assessment. Okay, so it's a different way. It's not necessarily you assessing the patient, which is an assessment, but assessment for us now at this level is broader. It's collection of information. Be mindful of that. Okay, so labs and assessment, literature search is an assessment. Okay, now number 5, safety of the patient and others is usually the right answer. Example, someone's been raped. So your first immediate answer is safety. Oh, that's simple. Okay, let's see. Someone's been raped. Which of the following would be your best option? A, ensuring the patient doesn't take shower so that the semen collection can be done at the hospital. I'm making this up, guys, okay? Or B, ensuring the patient is safe and has a place to stay overnight. Okay, so I know it's very easy now, but do you see the difference here? So, oh yes, collecting to ensure that we can prosecute, blah blah blah, the offender. It's important, but it doesn't precede the safety of the patient. So understand that. So safety, discharge, contract. I gotta stop for this because this is the old thinking. Anytime you see an answer that says ensure the patient do a discharge safety, all right, a safety plan, not a safety plan, a safety contract, okay, that can never be the right answer because this is the old way of thinking. That's what we did 15 years ago. We can do a safety planning, which is different than a safety contract. If you see safety contract, you can almost 100% cross that. That's the incorrect answer. Okay. Sexual abuse of children. Interview them separately, then report to CPS. But interview them first. This can get complicated, and then I see this question over and over again on the internet. Because you interview them first because that's your assessment, and then you report. We'll go through some questions and we'll clarify more of this. I don't want to take a whole lot on tactic strategy here. Trial abuse. If you suspect abuse, you obviously want to report, right? So, and you report to CPS and so on. Interview of adolescents, you want to ensure that you develop a report first before you go ahead and go to the parents and say, hey, this and that's happening, right? So you want to ensure that the patient can trust you, and you want to be, you don't want to break confidentiality, which is not privacy. Privacy and confidentiality are different. So this creates a ethical dilemma. Interprofessional collaboration is encouraged. We mentioned PEDS, OB, and substance abuse, right? Try not to delegate. So culture is important. We mentioned in depth about culture in nursing, right? Always look for an umbrella answer. Umbrella answer are those that are, let's say option A is reading, option B is writing, option C is literature, education, about health or whatever. So you want to pick the answer that covers most. Is reading important? Yes. But is reading inside of the umbrella answer? If the answer is yes, then pick the umbrella answer. Okay. You always want to validate the patient's symptoms, empower the patient. Somatic complaints, you want to ensure that that's normal within the culture. If my culture, we wake up at midnight and go out for 2 hours walking, then this is not a psychiatric condition compared to someone in America that may say every night I can't sleep and I have to take a 2 hours walk. That becomes more of an insomnia problem that we have to understand than what would be normal in my culture, waking up at midnight and taking a 2 hours walk. That's normal for me and for my culture. So it's not a psychiatric problem, okay? Even though it seems very suspicious, right? Native Americans, questions will come up about Native Americans because they are distinct. They have something about them that they do and that's normal for the culture, but it's abnormal to most of us. So be very aware when it says Native American. High risk for suicidal, Native American. High risk for alcohol abuse, Native Americans. Traditions like a healing stick, like rocks, or what have you, or a feather, they want to bring this into the inpatient. Allow them to bring in the inpatient. And if it was not allowed, talk to the nursing staff to educate them. So it can be a two-part questions, right? But it kind of goes back to culture. Information, but must be ultimately sensitive to the answer, right? And we mentioned this can be a correct answer, but it doesn't answer the question, so it's not the correct answer. Multicultural population. If you are educating a room full of multicultural folks, you want to not specific give advice for a specific culture. You want to be more generalized. Immigrants, make sure you accommodate for language. That means through an interpreter or so forth. Traditional healers, make sure that you allow them if the patient wants them to be allowed in the treatment, but at the same time, here's the informed consent. Please sign it or let anyone that you allow to have the information be part of this. Okay, so this was a quick and sweet. I just want to recap because I see a lot of questions getting wrong, not because of lack of knowledge, but test-taking strategies that's lacking. Okay, so please, I just want to go over this because it was important to a lot of people. Now, we're about to start our Kahoot. So 1 second, let me give you the code and let me give you where to go. Let's see here. So on your computer, you are to go to www.kahoot.it, and then it should come to a screen where it asks you for a pen. You insert the pen 222-8247. Go ahead if you're in. Start logging in so I can see who made it through this process here so far. I got Jenny. I got Linda. Anne. Dean. Dolly. I cannot see your chat box or either on WhatsApp or the Google Meet. So please, if you're stuck, ask for help. Linda is well-versed. Others, maybe all those folks that are joining in, they are well-versed, please. Latoya, you're in. Anne E, you're in. Two 82-247, you are in. I don't know who that is. You don't have to put your name either. April, you're in. Can someone help Marco, please? So, Marco, you say, where do I put in? So, get off the Kahoot app. Go to a brand new Kahoot, another screen perhaps, and just put a game. And then it should allow you to put a pen in. All right, Stella, you were in. We got 9 people in, and we have how many people in this today's event here? We have 16, so we're halfway there. Some people might be on a phone, so I mean, some people might be on a call, so they may not be. Marcos, you're in. So who is having difficulty? Please put this in your chat box on the Google chat box so Linda can give you guys a hand, please. Andy, you're in. Man, we have a lot of N's. N-E-D, N-D, and N-E.
So I'm actually in twice, so I'm on my phone and the computer.
Correct. So when we start the game, you look at your computer screen for the question, and you answer on your phone. So you need 2 devices, or you can put in one. Go ahead.
I'm Andy, right? With the cat, and then I'm also Andy with the panda. So I should not be logged in on both, I guess.
Yes, you should not. So only logged in as one person.
So which one should I log off of?
Whatever you prefer.
Okay.
It doesn't matter.
All right, I'm
Yeah,
gonna
just
try
log
to
off
log
one.
off one. Okay.
For those of you who want to do a split screen, I'll just go over that real quick. So whenever you open up your window, like you're looking at Dr. Lopez right now on a window, if you go to the very top of the screen, there's a little plus sign next to the window you're on. It's a tab. So if you press the plus sign and you put in Kahoot.com, it'll take you to the pin page automatically, and you put in that pin page. When you're done with that, you just hold the tab down where it has Kahoot and move it to the right. You will see that it will leave the window you're on and create a second window. And you can actually make that whatever size that you want, so that you're looking at one half of the screen is Dr. Lopez, and the other half is where you're going to mark your answers. If there's any questions about that,
Yeah, thank you. I got that. I'm gonna get off my phone. I appreciate that.
Okay, absolutely. Does anybody have any questions about how to split screen? I can do it again.
All right. So other than Ann that just log off on one, is there anyone that's having trouble? Because not everyone may want to play, or some people might be on a phone call. I'm not sure. So just let me know if you're having trouble. We can wait a little bit. That's not a problem. I just don't want to be waiting if there is nobody else that's going to play.
If you are not going to play, if you could just write your name in the chat box so that we can count how many are not playing, and we can go ahead and move forward.
All right, Marcos. 2 Marcos? All right, we got 1 Marcos now. Okay, Kelly is back. All right, folks, I trust that you guys got the process. Anne is here. I am about to start. This is how it's going to be. You get points for the correct answer, and you get points for being fast. Let's say player A and player B, they got both the correct answer, but player A was faster. He gets a little bit more points. We can talk about the rationale. but preferably, I like you guys to give the rationale for the correct answer. You can just unmute yourself and say the reason why. So that way we can go a little bit deeper. This is fast. You only have about a minute per question. A minute per question. So it's fast and accuracy. Most importantly, this is a review of what you already took the question, right? So this is the time to review what we learned during our pre-assessment or diagnostic test that you took, number 1. Number 2 will be released later. I am on vacation right now, but I told my wife I have to do this. So it'll be about an hour and a half, maybe more, okay? But if you have a specific question, I can always make the time to meet with you and make sure that you're good to go for your test. I assume everyone is in, unless if somebody tells me otherwise.
I just wanted
We're about-
I just wanted to re-mention, so for those of you who were not able to make the first one, it was a little bit confusing with the Kahoot. So if you have 2 different screens, one side will have the question, the second side is only going to have a color. And so the answer choices are going to have 4 different colors. And on the other side of the screen or on your second device, you're actually just going to be picking a color that corresponds with the answer choice from where the question is. So people thought that maybe the answers weren't typed in the color box or whatever. There's no colors, there's no A, B, C, D. It's just a color and you associate it with the answer choice where the question is.
Perfect. Thank you for that.
I have a question. This is Anne, Anne E and Anne. So I couldn't get that. I mean, should I be saying Anne E on my phone?
It doesn't matter.
Okay.
As long as who you know your character, it's fine.
Okay.
It doesn't matter what
Okay.
your name is. Your name is just for you. I don't need to know what you score precisely. It's just for you to know who you are among those students.
So if you have 2 names,
Yeah.
don't worry that you have 2 profiles up. Just only answer on one profile. Don't
Okay.
switch back and forth. Just choose one to answer on and just continue to use that same profile to answer.
Okay. Perfect. Thank you.
Okay, guys, we're about to start. The first question is coming up. 1 second. One answer. Okay, so this one, it's a complicated, very complicated question, right? And the reason why is that root cause analysis is because you're taking action into a problem that you already have recognized. When you do the planning study, do act, which is a very, very attempting answer, right? You are planning the process, but you already have collected the information, and is a better choice for this question. And most likely, I would expect a lot of people to get this question wrong, because root cause analysis we always identify as something bad has happened here, right? But it can also be used in cases where we are trying to find out what's wrong with the hospital. In this question, more specifically, transferring the patient. Very hard question, this one, okay? All right. Who's leading the pack? Marcos. All right. Just one question. If you need to discuss something, let me know. Only got 5 answers. 7. 8 answers. Come on, got somebody here to answer. All right. All right. So benzotropine, right? So we see this conditions where the eye are deviated. This is a very urgent condition. Can somebody name this condition for me?
Dystonia.
Yeah, it's a form of dystonia. Yep. Okay. So ocular gyrus, more specifically, but yeah, it is a form of dystonia. Dystonia is also correct. So you give benzotropine. Okay. Now nobody picked. Oh yeah, we have one person that picked hydroxine. That's also anti-same answer because it's an antihistamine, right? So, but it's not precisely what we would give. We would give IV Benadryl or benzotropine to correct this condition. When you see patients like this in the ER, is actually one of the best feelings ever because you see the patient can't talk, the face is all creamy, and they are in a lot of pain, and you give them medication, then 15 minutes they are fine. So that's I love those cases because they come to the AD, the doctor is a bit lousy, doesn't know what to do. I usually give IV Benadryl 50 milligrams, and it'll correct the problem within 50 minutes. You need more answers, 10 seconds. Pick an answer, even if you don't know. All right. So the question says the least, right? So we don't tell someone from Cambodia that they have to be like Americans or something along those lines, right? That they have to assimilate into the mainstream culture, right? They can still do what they do. They can still be within their cultures, understanding the context of the patient perspective and the experience. That's the umbrella answer. It's good. Engaging and empowering the patient, can never go wrong with that. And clarifying the meaning of the illness or symptoms in their own perspective. Okay. If you have questions, please let me know before we can go on to the next one.
Oh, can I get Kahoot? I think it's red.
Excuse me, guys, I'm working. Okay, so everyone got this correct, and there is not much to talk about. Just a test taking strategy. First thing you need to do is collect the information, and you do the collection of information by collecting the lab. You saw the symptoms, patient was stable. Test taking strategy would have worked well here because option A, increase prescribed medications and action, is not collecting. Decrease the prescribed medication would not do nothing because the patient is stable, and change the medication would also be incorrect. So doing the assessment portion here is referring to the lab collection. Please sign. Come on, guys. 25 seconds. All right. So here, I want to clarify a few things. Somatic symptoms, they are real. They believe they have. They're over preoccupied with their symptoms. Oh, I must have a heart attack because I'm feeling bad. Because it's chest, my chest is heavy. I must have it. I will do anything. Factitious disease, it's something that they want to get something out of the system. They will, whether it's pity, whether it's love. Oh my God, I'm so bad. I feel so bad because you are going through this. Whether it's money. Malingering is when they don't want to get anything out of the system. I'm sorry. Let me reverse. Malingering is when they want to get something out of the system. They're doing this because they have a benefit to get. Factitious is when they don't want to get something out of the system, but they just want to get a kind of love or cared for or feeling of cared for. So don't confuse malingering and the fictitious disorder. Now, the root of this question is undoubtedly conversion disorder. Conversion disorder always will be preceded by stress and a neurological symptoms. Neurological symptoms can be motor or blindness or paralysis or anything, but they must have a distress. In this case, it was the wife, I believe, that passed away, and all the signs the person was having a distress. Very clear conversion disorder. So your goal here is to go back and look up somatic symptoms, somatic disorders, conversion disorders, factitious versus malingering, because they will mix this up. They will mix this up. So
For
please,
those-
everyone, go ahead, please.
For those who have learning association or learn by association, if you just remember that money and malingering both start with an M.
Perfect. And the factitious is, they just want to like factual love or care for. Here you go. I don't know. So anyways, so good questions. Please understand those four because you will get those questions or something along those lines. I guarantee you they will try to trick you. All right, Marco's leading the pack here, followed by AW. I don't know who that is, but. All right, perfect. Test taking strategy. All the beginning of the theme of the question is all bluff. So you highlight what's important. FDA approved for GAD, GAD, and there's a adjunct therapy medication, right? Perfect. Come on, guys, 5 seconds. Pick one. Perfect. All right, so everyone got this correct. So here, test taking strategy, you don't need to know the doses or side effects specifically, but option A, B, and C there, they all falls into the SSRI, and then you have one option that does not fall into the SSRI. So even if you didn't know which one to pick because you didn't know was Wellbutrin, you could have used test taking strategy to know that 3 of them fall into a bucket and the one doesn't. So pick the one that doesn't. So obviously knowledge would be your first resource. Not knowing the answer, go to test taking strategy. Okay, so this one, everyone almost did so well. Some people did not answer the question, right? So we have to pick an answer even if we don't know the answer. In the test, you strike through 2 answers and you keep the 2 that you like the most. Here has nothing to do with Lewy body. And when you hear Lewy body, think of vision, hallucination. When you hear about the DAT, dementia, think of the most prominent dementia condition, right? But it didn't have anything about dementia other than possible age. So you can eliminate A and B. Then you have these 2 weird answers here. And the correct answer was a more problem significant to alcohol. So it will be the Wernicke's encephalopathy. But at least you could, by doing testing taking strategy, you could eliminate 2 answers there, A and B, even if you didn't know the answer.
Oi, ui. Não, that's good. I felt that. Achei que você tinha tomado, sorry. Eu vou lá pegar. Eu vou lá, crianças. Eu vou assim. Pegar o café.
All right, perfect. So as you see here, for all the answers on your practice test, if you didn't know what the Asperger syndrome is, your job is to look it up, right? So that way, we didn't cover in detail Asperger, but I just gave you a little bit of how it's related to Tourette's. But your job is always to never let any question go without the full understanding of the question. Good job, everyone.
What type of coffee do you want? Black? Black? You want one cookie?
Okay. Again, we did not have people picking a choice. Okay. Let's go over this question. Before you send anything to the pharmacy or prescribe medication or see a patient, said it was the first time seeing the patient, what do you need? You need informed consent. Okay. So why is not lab, right? You would say, is that something that we do before prescribing a medication? We collect the labs? Not in most cases. What happened?
회원 여러분 안녕하십니까?
Sorry, guys.
저희 비발디 파크를 찾아주신 것에 진심으로 감사드리며 잠시 퇴실에 대한 안내 말씀드리겠습니다. 금융 리조트 퇴실 시간은 11시까지입니다. 11시 이후에는 시간 초과료가 발생되오니 이점 양지하여 주시기 바랍니다. 퇴실코자 하시는 고객님께서는 사용하신 주방용품을 세척하여 건조기에 정리하여 주시고 사용하신 침구는 방 안쪽으로 모아놔 주시길 바라며 발생된 쓰레기는 복층 복도에 준비되어 있는 쓰레기 버리는 곳에 분리수거하여 주시기 바랍니다. 또한 퇴실이 집중되는 10시에서 11시 사이에는 엘리베이터가 매우 혼잡하오니 이 점 양해 부탁드립니다. 귀가시 안전운전하시기 바랍니다. 감사합니다.
All right, my apologies, guys. I am in South Korea right now. As I mentioned, I'm in a hotel. So let's go back to the question. Get informed consent, right? It's the first thing you do. Seeing the patient the first time, make sure you got your informed consent. You let them know what are the conditions in which you will break informed consent. That's high yield. High yield. You need to know when will you break informed consent? When someone is in harmful way, when the patient is in a harmful way, things along those lines, right? So you don't necessarily in practice collect labs and then you prescribe, right? So usually, very rarely I can say that I would do that unless if I'm very concerned for whatever that is. So your first action is informed consent. So therefore, it would not be the labs. Insurance competition is important, but going back to test taking strategy, always the answer is patient focus. I'm not focused on insurance. Oh, okay, I won't get paid if I don't collect insurance. Yes. Question is not concerned about how necessarily you're going to get paid, although you could get a question, but I'll go back in another video. But the question is always look for patient focus. So the goals of today is to match the strategy to the answers. Okay, just want to clarify something else. If the condition is a psychiatric condition, and in addition to a substance abuse disorder for the same patients, you need how many consents? You need 2 consents. Okay, so you need 2 consents when you have a substance use and a psychiatric condition. All right, so hopefully this was clear. If not, let me know, please. Okay, not much of a change here on the scoreboard. You guys doing great. Come on, 6 seconds. All right. So hard question, right? We could eliminate D there. Reminiscent therapy is for usually older adults, coming back to old good days. Experiential therapy is the one that usually tries to develop their own self-awareness. Then we have solution focus and structured play therapy. So you're using a doll deliberately using for therapy, and that's more of a structured focused play therapy. Okay, but a solution focus is also very tempting, but not the best answer out of that. Okay, that's taking strategy. Well, the moral reflex is the baby, where they kind of go backwards with the palm of the hands. Then you have positive Bambinski. So positive Bambinski should not be this the case, right? When you have a positive Bambinski reflex, after 2 years old, that means there is a neurological problem. So you could eliminate A and B right away. I mean, A and C. Then you have a B and D, right? So if the person has positive symptoms, you would not expect a negative result. Therefore, you're left with the option positive current signs, which was actually what was described in the question. Okay? But always associate your test-taking strategy along with, I cannot see you if somebody's putting a text there, okay?
Is the curtain sign, is that the one where they bend their head to their chest and
To
it
the knee.
creates
Yeah.
pain? Okay.
Mm-hmm. Did I? Okay. Am I still showing my? Am I showing my screen? Fine.
Yes.
Okay. Did I? Oh my! I don't know what I did. 1 second. All right. 1 second. I kind of lost my screen here. Okay. Is my screen showing? No. No.
That's showing.
Oh, good. Okay, it is. Okay, just slow. All right. So Mark is still leading the pack here. Perfect. Well done, everyone. That's very good. Okay. All right. So I think that's you guys got the point. The point is safety. I thought someone would say discontinue Depakote, which would be incorrect. The right thing to do is get a pregnancy test because of why? What's Depakote associated with?
Damage to the tube, like the neurological tube, something like that.
Yeah. Neurotube syndrome and cleft of palate.
Left pallets.
Yep.
Get it down.
And neurotube defect, right? All right. So, and that goes for anyone age of 12 to 50 years old. Don't ask questions. Female, you have to be aware that the possibility of getting pregnant. So please make sure you get, for any mood stabilizer, in antipsychotics, most of them, you should get a pregnancy test alongside. All right, very good. This was really knowledge. Schizophrenia patients are considered the most psychiatric condition with the propensity for suicidal actions. Homicidals would be the antisocial personality disorder. Eating disorder is also very high for suicidal ideations. And bipolars, they don't want to die. They just want the distress to go away. So they are in stress intolerance. Okay. If you guys have any questions, you can feel free to add between the questions there. Okay, so conduct disorder. Geez, I forgot the question. So substance use, right? So it's a for CBIRT. So CBIRT for any alcohol or other drugs related. So basically, what we're going to do is assess the CBIRT. We are going to use the audit tool because the audit tool will help us to see if our intervention was or was not effective. Okay, conduct disorder usually, not usually, always is a discrimination for the age group. That goes with personality disorders and the children disorders, right? So if a question ever says is a child, well, if the question ever says a patient with antisocial traits, but the patient is 15 years old, you can cross antisocial personality disorder and you can cross all the personality disorders, because personality disorders, you have to be older than 18 years old. Then you want to do focus therapy on the anger management for those folks with the conduct disorder, so they don't shift into a antisocial personality disorder. When you have a question about nighttime bedding of the children or things along those lines, the first thing you need to do is do an interview in a family to make sure that they don't have a history of it in a family, right? You could add a TCA, but this would be like really down in the lines of a treatment. So the order here, CBIRT, you want to do outer screening. You can use the
Paige, are you frozen? Dr. Lopez, you're frozen if you can hear me. I was just gonna say something. I just came off a pediatric rotation, and they do have like if the child has had symptoms for 1 year or longer that are persistent, some pediatric providers do diagnose with borderline personality disorder. However, it is very rare. And he says he's lost connection, that he's coming back on now. Guess go ahead and answer that question. Are you on? You're on mute.
Oh man, okay. Sorry about that. So I lost connection. Let me see if I can go back here. Okay, so everyone got this question right? Can you guys see my screen? Yes.
Yes.
All right. Perfect. All right, got 2 seconds. Okay, perfect. So the only thing I have to say about here is that somebody did not answer the question, not sure. Assault is the threat. The battery is the doing the threat, okay? And tear off is the duty to warn, has nothing to do with this question. Obviously, this was a negligence case. Six answers. Fifteen seconds. Okay, pretty easy, right? Black box warning for all antidepressants. We covered this one earlier. 10 seconds. All right, pretty easy. We covered this earlier. So you can summarize all the reflex being abnormal, most of them, generally speaking, between 6 to 8 months. The majority will be abnormal, but the one that stands out is the Bambinski. It should never be the case after 2 years old, usually resolved by 12 months. Ten seconds.
회원 여러분 안녕하십니까? 저희 비발디 파크를 찾아주신 것에 진심으로 감사드리며
Alright.
잠시 퇴실에 대한 안내 말씀드리겠습니다. 금융 리조트 퇴실 시간은
One second, I have the speaker over here speaking over my head.
입점하셨다. 다음 걸리다.
가 매우 혼잡하오니 이점 양해 부탁드립니다. 비가시 안전 운전하시기 바랍니다.
All right, I'll go over this question in a second. So basically, the previous question was a very hard question. Restoration would be the answer there. There's no testing strategy for that one. It's pretty knowledge and a very hard question. I don't know what happened here. Can you see my answers? So, go to skip. I don't think you could see my question, correct?
We can see.
You can?
Yes.
No, I could not see the question.
Yeah,
Oh, yeah.
no, can't see it.
It says, which one do you like? And there's a
Yeah.
few couple questions that say that.
Right. It's but you should see the screen with the question. So I'm not sure what happened. I'm gonna just skip that one. All right. Somebody got hot mic there.
Yes.
All right, it's a very good. Definitely see there. Acute drug-related poisoning is a distraction, and also D, right? So D is looking for those that are may hear this a lot. Stevens-Johnson syndrome, right? but this question has nothing to do with Stevens-Johnson syndrome. When you hear Stevens-Johnson syndrome, you ask the patient to look inside of their mouth. Do you have blisters? Do you have blisters all over the body, right? So this is an acute drug-induced rhabdomyolysis, very classic symptoms.
Someone had asked if you could explain what rhabdomyolysis is.
Yes, so rhabdomyolysis is pretty much, in summary, a breakdown of the muscles, right? It happens often after someone's been in the hospital someone's been exercising extremously. I see this a lot in that case. And they will come back to the ER and they'll have a ask for urine collection, and their urine will come back like dark, like Coca-Cola or like a dark tea. Right? So I know right away this is rhabdomyolysis. And how I'm going to treat...
Ugo Samuel, can you put your... Thank you.
And I'm going to treat those patients with a lot of IV fluids, usually 4 liters to 5 liters, of course, if they don't have a cardiac condition, right? So this is, I would put them in a med surge, I would treat them with lots of fluids. It should clear up. The liver's enzymes should come down substantially within 3 days, usually. Okay. So, but in summary, that can also poison the liver, right? So therefore, a kind of distraction there was drug-induced poisoning, but not the correct answer. Does it help? Does it answer your question? Am I mute?
I was asking regarding the one that said which. Okay, so the one that was which one would you like? He just skipped it because there was no question along with it. So he just did away with the question altogether.
Yeah. Okay. All right. Next question. Well, good. All right, guys, 10 seconds here coming up. Perfect, right? So you need to know those 4 terms in detail. Test makers will find a way to confuse you. When you develop a tolerance to a drug, alcohol, or anything, in fact, let's give an example, SSRIs. If patient been on Zoloft 50 milligrams for a year, and now they start having symptoms of major depressive disorders, again, it's likely that they develop a tolerance to the medication. Addiction, it's when you're addicted to the drug and you will continue to do the harmful behavior despite of consequences, losing a job, getting divorced, money problems, so forth. Dependency is when you're dependent of the drug. By stopping the drugs, you will have withdrawals. And substance use disorder, you guys know that one. Hopefully this was a helpful explanation. All right, tricky question, right? So it cannot be Tourette's because Tourette's you need 2 modem and 1 vocal. In Tourette's, it has to be over 1 year to make the diagnosis. Okay, it's provisional here because it's not. It was, you know, it kind of want to say to you, hey, it cannot be Tourette's because you don't have the whole year, right? Stereotypic movement disorder. It was possibility, but it didn't go in detail by saying the patients, you know, have a stereotypic movements. So it just said tics. So the most likely diagnosis would be the provisional tic disorder. Okay. But you guys doing great there. Okay, so these are court cases. When you hear O'Connor, I want you to hear this guy that was in the inpatient hospital for 15 years. And he tried to leave, but he couldn't. The doctors wouldn't allow him to leave, even though he was a threat to no one, right? Then you have, I put a reigning and claim twice. So the reigning claim has to do with the medication, the rights to refuse medications. And then you have the Dusk versus United States case there. The Dusk, it was more of a related to, oh God, now I'm failing my memory here. The Dusk, I don't remember right now, but I think was related to the death penalty as well. Okay. But even if I didn't know any of these, right, I could eliminate B and D just because they are the same thing. So,
Doctor.
Dusky
Yes.
is the Dusky was a Supreme Court case for the defendant's right to have a competency evaluation before proceeding to a trial.
That's right. Okay. Yep. There are like 9 different cases, and I'll post them up. They're kind of important. They've been historical. So another thing that I want to say about the cases is you don't need to know the whole name. Like, for example, I only remember O'Connor versus doesn't matter because they will not mix the cases. So they will not mix O'Connor versus Dusky. You understand what I'm saying? So rather than memorizing the Dusk versus United States or Dusk versus whatever, just memorize the Dusk case. Okay, these are strategies. I always remember O'Connor case. I don't go into O'Connor versus whoever. Oh, what happened here? I don't know. Let me skip it because I don't know what's not showing up.
Doctor,
Yes.
I have to go.
Okay, no problem. I'll have this recorded and then it'll be on the platform. Okay.
Okay, perfect. Thank you so much.
Thank you. Bye-bye. So for this case, the most important lab is CBC first. Then you want to distinguish between, you want to get iron, B9, and B12. This is a knowledge question. There is no test taking strategy here. Okay, so everyone got this one. Well, most of you guys got this one correct. Correct. Option B, the NMDA, right? So I'm referring this to medications for those with Alzheimer's, dementia-like. Nobody picked, boy, one person picked that. And so it's the same category as D, the cholinesterase inhibitors, right? So test taking strategy here is I really would eliminate both of them because they're in the same class. There is no benefit of one over the other. And then we would go for either A or C, which we obviously would go for atypical second generation antipsychotics due to the 5H2A and 5H partial one was 1A, 2A's, because of the 2A's and sometimes the partial agonism as well. That sometimes comes back, but most important are the 2A's. All right, well done, everyone. Why it wouldn't be A? Nobody picked that. Very surprised. B is the correct answer. So those that develop any kind of a EPS early on, they would be more likely to develop TD later on and Parkinson-like symptoms. Then hypertensive crisis. Okay, I get that, but the question did not indicate anything towards hypertensive crisis. So. Mhm. Ten seconds left. Okay, so regards to dopamines and neurotransmitters, let's start with DNS. So DNS, you have major depressive disorder, ADHD, and Tourette's. Questions that ask about feel good, gambling, or drugs addiction, that's your dopamine, right? So by knowing that, you could eliminate D right away. Then you would have, you know, that's the DNSs are three, ADHD, major depressive disorder, and Tourette's. Eliminate A. Then you have glutamate and dopamine and glutamate. That's your schizophrenia patient, right? Dopamine and glutamate mainly. Obviously, there is more. And then you left over with the dopamine and GABA. Dopamine and GABA is for the feel-good drugs-like substance. Rewarding, right? All right. All right. Anyone? We have more than 7 people participating.
So my phone never, I put in my answer, but it never comes through until right when these come up. I don't
Oh,
know
really?
why. Yeah, it just
Okay.
keeps running and running, but then it does. I think I'm
Okay.
in there. Okay.
I cannot fix that. Sorry. So when you think about ADHD, I want you to think of 3 brain parts. ADHD, I want you to think 3 brain parts: frontal cortex, basal ganglia, and the reticular activating system. Don't forget that. Pons is the incorrect answer. Or correct, because that's what the question asks here. But ADHD, 3 brain parts are involved mainly. Somebody got a hot mic?
Hugo, your mic is off.
Delapo Fox, can you mute your mic? Ugo Samuel, can you mute your mic?
All right, perfect. So question A there, right? Answer A, does it answer the question? Right? It doesn't quite answer the question. So it falls in that category that even though it's correct, is not answering the question. That's taking strategy, right? So B, your records are provided upon request if signed a release consent. So that's a pretty umbrella answer and the complete answer. So that for that reason, it is the correct answer.
후원 여러분 안녕하십니까? 저희 비발디 파크를 찾아주신 것에 진심으로 감사드리며 잠시 교실에 대한 안내 말씀드리겠습니다.
Okay, so you guys saw the answer there. That's pretty much a knowledge question. Hopefully nobody has a question, but ten seconds. All right, well done, everyone. We have a new leader now of the pack. Okay, so here it wasn't a complete question. I get it, but the point is that someone has generalized anxiety and has a score of GAD-4. So the theme of the question is looking, what do you do at the number 4, right? So you know that between 10 and the 14, you are at the moderate range, right? So you know that 4 is a pretty low number. So you would definitely not increase the citalopram, and you want to keep it at the continuing dose. A better question would have been, the patient's on this medication for 2 weeks or 4 weeks. What would you do if the score is 4? The answer to that is complicated. Let's say that the question would have been, patient's on this medication for 4 weeks and the score is 4. What would you do? The answer is always to keep the same no matter what for 8 weeks, unless if there is a suicidal planning or increase of suicidal thinking. Then your option here is to stop the medication immediately, not to switch to another one, is to stop the medication. These questions like this will get a lot of people because the test will say, the patient's feeling good, been on the medication for 4 weeks, come back to your office, what would you do? And a lot of people would increase the dose, decrease the dose, but your action is the knowledge of what the score means of the GAD plus how long the patient's been on it in order to make a complete answer. I posted a question like this on Facebook, and people really got it wrong. So pay attention on that one, especially the time frame. And know that your SSRIs or antidepressant, the goal is really 9 months to 12 months of therapy to produce neurogenesis, okay? So development of the neurogenesis process. All right, we got a tie here, right? But the answer is fluoxetine. Let me look at here my medication books real quick. Just to double check. I'm pretty sure. So according to my app here, OCD, you can use certainly use Zoloft age 6 and older, but you can do major depressive disorder and others for okay. So you can do the answer is fluoxetine or Prozac, okay? And now it's leading the pack. All right, guys. So the other three options, Geodon, Abilify, and Latuda. Geodon, Abilify, and Latuda, they are the least weight-gaining medication. They are also the least sedating is Abilify. Olanzapine is the most weight-gaining prone medication. Okay, so that would be a high risk for metabolic syndrome. All right, Linda's coming up next, second place there. Okay, very good. So even if you didn't know how to answer this question, you could look at the theme of the question, and then you would have depression and alcohol, along with option A there, alcohol and depression, but that would be the most reasonable answer. You don't want to ask if the person just drinks socially, right? So you're not imposing a question, because there will be also a yes or no answer, yes or no. And then, can I refer you to alcohol treatment program? What if that was a good choice, but it's not really treating her major depressive disorder, right? So best option is A. Only have 5 answers now. All right. So A, reactive attachment disorder, has nothing to do with that. B, opposition defiant disorder, right? So that's the one that disobeys rules, doesn't want to follow the rules. But this is a pretty clear cut of conduct disorder, right? Because that's more aligned with antisocial personality disorder. That's the one we want to treat them for, so that they don't become antisocial personality disorder. Another thing that's taking strategy here is look at the age and look at the conditions, right? Even though he didn't put a personality disorder, but if it did, you know it cannot be a personality disorder because it's 15 years old. Now, disrupted mood dysregulation disorder. When you think of this, think of the little guy that's bipolar. I'm not making fun of the little kid, okay? But this diagnosis was created because we put it too much, we gave too many diagnoses of a bipolar to children and adolescents. And we said, hey, we have to stop this. We have to create a new diagnosis for the kids so they don't get labeled. Because once you got labeled with bipolar, you no longer can join the service. You no longer are allowed to do certain things. So your diagnosis can really determine someone's life. So now they created the disruptive mood dysregulation disorder. Okay, so also again has to be less than 18 years old. Okay, but it didn't say anything about live bio mood or increased need of increased energy levels and decrease of need to sleep, right? So it doesn't fit the characteristics. And still winning. Wow, I am so proud of you guys. I was ready for a big argument here, but obviously all of you guys got the point. So very, very good. All right. So you want to interview the patient separately. And I thought you guys would pick most call CPS immediately, right? Because I hear this a lot. So very good, guys. So first you want to do an assessment. If you have the opportunity to do an interview with the patient separately, that's what you do. Then followed by call CPS and so forth, right? Call the police is always appropriate, but it's likely not your best first action. Very good, guys. Okay, so as we mentioned earlier, right, Erickson will get a lot of people. Let's say you did not know any of that, and all you knew, it was the age. And I believe the age said 11 years old, right? Of the 11 years old, that's your industrial versus inferiority. So if you couldn't really match the question to the answer, look at the age. Erickson, it's always the same age as the age given. So if you can write it down on your dump sheet, Erickson, all the ages and all the appropriate ages that we go through in our course and find a way to memorize it, then you can easily match it, okay? Now, trust versus mistrust, you can throw that one away because we know it's usually, well, some books says 18 months old and younger. Some says 0 to 12. I say 0 to 12. Then you have identity versus role confusion, which is very tempting, but that would be more of a 13 to 21 years old, right? So really far away from 11. And then we have initiative versus guilt. So that's 3 to 5. So we have 13 to 21, 3 to 5, and 0 to 12 months. Really, if we know the age, we could have got all these questions correctly. Okay, does it make sense?
Yeah, there was another hint in there. It specifically said that the child felt inferior to.
Yes.
So
yes, it did say that, and I read that. I was like, oh man, that was a give it away. But it's always better. It's 1,000 times better that we get it wrong in the practice exam and understand the reasons why, so we don't repeat the same errors, right? We all have a tendency, or I would think most of us, at least I do, to postpone the test until I'm ready to take the test. Guess what? Very, very rarely you'll feel 100% ready. This is not a school test in which you have to get your A's. You know, I want A's. I want a perfect score. All you need is to pass, okay? So don't delay taking the assessment that we have for you because you're not ready. You can take it again as many times as you wish. Okay? Yes, please.
I didn't pick industry because they said on the question that he didn't match his age. I can't read the question again, it's gone. So he didn't meet his, industry and that. So I thought, you have to go down on the next age or industry or whatever.
Right. So the age of inferiority, industrial versus inferiority, right? That's another case in which you don't have to memorize both names. I just memorized the first one. It's 5 to 13. And
Okay.
the age in the theme of the question, I believe, was 11, correct?
Yes.
So does it?
The question said which one is he not progressing through?
Oh,
Progress-
yes.
Yes.
Okay, thank you. So yeah, even though, but it comes back to the same strategy, right? It falls into the age that was industrial versus inferiority. And then the question gave why he wasn't progressing through. Was it clear?
Not really. So the answer is the industry versus inferiority.
Yeah, because the question said he was inferior to other. I am so dumb, something along those lines. So, you know, obviously he didn't pass those stages, and he didn't progress through it.
Okay.
So I think the confusing part, because I've seen these questions asked a different way as well, where it asks what stage did they not successfully progress through? And it's
Yes.
always like something younger. So like if the question had asked the 12-year-old going through industry versus inferiority is having trust issues with his parents and his friends and whatever, which one did he not progress through? Then you would go to younger because he didn't progress through trust versus mistrust. But this question is asking this 11-year-old feels inferior. Which one is he right now not progressing through? He is not getting through the industry versus inferiority stage very well. He's stuck in it. So that's the one he's not progressing through.
Okay.
Thank you. Yeah. That's actually a very good clarification. Thank you. It was Linda. I cannot see you. So,
Yeah.
all right. So, yeah, very good clarification there. Does it make sense to everyone now?
Yeah.
Okay. So, thank you for asking the question. So, even though we're kind of in a hurry here, kind of going fast, you can stop in any time and say, I don't understand. So, I would much rather take the time and explain it now, and you get this question correct on your test. Okay. So, stop me anytime.
Thank you.
All right, I like how you guys thinking here, but this is more precisely a LFT question, right? It's more specific. Glad no one picked CBC or lipid panels, but I can see why CMP was one of the most picked options here. But anytime you see drugs, the key here is like, you know, what we order. How is the drug metabolized? Either by the kidney or by the liver, most of the time, right? Other ways, but most of the time, that's the organs of in question here. Oh man, I did not read the question. What was the question? Sorry. Okay.
That was about presentation.
Yeah. So I'm so sorry. This is keyed incorrectly. So this is fund of knowledge. Okay. So you this is not collecting registration. Registration is, can you remember something that was said immediately within a minute?
Yes.
So anytime you ask about a governor, who's the president, who is the state, whatever, that's very, very common knowledge. You look for fund of knowledge, okay? So your cognitive status, that's easy, and your orientations, time, place, and so forth. Can somebody give me the reason why you went for orientation?
Person, place, and time. The person. It's a very common question to ask. Who's the president of the United States for orientation?
I never heard of that before, honestly. But that's a fund of knowledge question. I always do for orientation. You give me your name, your place, where you are, and the time where you've been. What time is it, or where you are now, what's your name? So place, name, and time. That's what I do for orientation. But good to know that's why probably 2 people picked orientation, and that's a good rationale. But if you hear fund of knowledge, it's general knowledge that everyone should know. If you ask a 10 years old, he would know who's the current president. Okay.
And the registration, that has to do with being able to repeat new material too. So
yes,
unlike recall, where you just tell them 3 words and they're words they already know, that's just recall. But if it's registration, if it's 3 new words they don't know, and then you ask them to repeat them again, it tests if they can remember new things.
All right. Very
But
good.
registration is the one that's checked. I mean, I picked fund of knowledge, but registration is what was checked.
He said the answer key is incorrect, and it
Oh,
is
I see.
knowledge.
Okay, I missed that. Okay,
Yeah,
good. Well, I'm
thank you.
glad because
No, yeah.
I got it right then.
Yes, you got it right. All right, 25 seconds. One more answer. We're missing somebody here or 2. All right. So the trick here, it was to make you think this is schizophrenia, hallucination, agitation, right? But all this really could be due to a UTI. How test taking strategy he is, he was admitted to the hospital for a week. You have been tasked to assess the patient after noticing change in his mental status. So that comes to delirium, right? So hopefully that helps you. But that's a delirium question, right? You need to know, you need to be able to understand deliriums versus dementia versus major depressive disorder. All right. Okay. It's a bad question here, not a very clear question. So I'll just skip it because really it could be two answers here. It could be B and D and really A. The point is that you want to avoid anything that could cause a patient to fall at the older age. So this question is invalid. Okay. So let me skip that one. Not a good question. Test question though. Okay, so you want to collect information. You do a order of thyroid panel.
Are you frozen? I think he's frozen. You're muted.
I lost connections. 1 second. Can you guys see my screen or no? Not yet.
Not the Kahoot screen, no.
Okay. All right. All right. Not getting through. I think my hotel reception here is not the best. So, what do you guys thought about this exercise, the strategies, and the questions with Kahoot? We went through almost 50 questions. Hopefully, it was helpful. You guys want to provide any feedback or anything? Or I can try to go again and reconnect the Kahoot, but we're gonna lose all the points and everything else because it's not connecting through my end here.
I just had a question about, I mean, that last one was probably the trickiest one for me. The other ones, maybe I just didn't read the questions correctly because I was going too fast. But because I just feel like given some of the symptoms, like they were like on the line, they're on the border, but the person was diaphoretic. And if I were to order as a PMHNP, if I were to order a thyroid, I wouldn't get that result back for 1 or 2 days. So if that person had some kind of a comorbid condition like diabetes or even like they were heading into thyroid storm or anything like that, then like ordering a thyroid just seems like it wouldn't be the most appropriate thing to do because it wouldn't keep the patient safe since they were symptomatic.
Yes, very good point. Very good point, actually. But I guess what the question, maybe the questions could be rewritten in a better way. Like, for example, you are consulting with a patient and you work in the inpatient unit. So I work in the inpatient unit. Sometimes I see my patients coming in, I order labs, and then make them wait, and then provide an outcome, right? Or maybe the questions would have been something like, patient came through the ED with those symptoms, right? That would have been a better question.
Yeah, for sure.
So, but the point was to ordering the lab leading to the diagnosis, to the correct diagnosis.
Okay.
Okay. So that's actually a very good point. Maybe the question was misleading some, but there is something, I go through a lot of questions. I make a lot of questions. And sometimes it's fast and sometimes it's not well clear, but rest assured when it comes to test day, the questions will be very, very clear. So only get the information that's provided. Don't over extrapolate.
I guess in that particular question, it seems like it was more of a
urgency. Yeah.
Well, there's more of like, there's no great answer, but what's the best answer? And I wouldn't have admitted them to the inpatient psychiatric unit either. I would have said go to the ER. So
absolutely, that's what we've been. Yeah, actually, that would have been an even more strong reason to dissuade you from admitting to the psychiatric unit, right? Yes. If that was the answer choice, but absolutely. So what are the questions, or how else can I help you at this point? Okay. So we are not going to reset the game, otherwise you'll lose all the points. I'm unable to reconnect here. So like, as I mentioned, this was impromptu, doing a vacation with the family, and just want to get you guys in for a couple of hours and go through test taking strategy. Please make sure all the information that is in a PDF is completed. Make sure you're writing down all your questions on a section below your training so other people can see it and other people can comment and collect some information along the ways. So I think this was helpful. If it was, we can always, do it again. If it wasn't, we can find other ways to meet as well. But I think questions and answers and going through rationales, we learned a lot. Okay.
That was good. I love it.
Alrighty then. So I'm glad you like it. So, any further questions?
When are you going to be off vacation so that I can reach out to you? Because I'm not urgent, but I don't want to